Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we coordinate with Canada India Network Society and we have Dr. Arun Garg and a special guest, Dr. Reena Khurana. Today, we'll be focusing on diabetes and especially during pregnancy, how diabetes can impact and what lifestyle we need to adopt. So, we'll have Dr. Reena talk in details to us, but about Dr. Reena, as usual, let's get both our guests and Dr. Garg will introduce Dr. Reena. Dr. Garg and Dr. Reena, welcome to the program.
Nice to be with you.
Thank you.
Good.
Dr. Reena,
As an introduction for Dr. Khurana, uh, as always, it's a great pleasure to have a colleague join us on this special Harpreet Singh show where we talk about integrative thinking, integrative health, and into how we be healthy. So today's show is uniquely special, Harpreet, because we are talking about a specific disease and how lifestyle and uh, chronic diseases interact. To lead us through, my colleague, Dr. Khurana. Dr. Khurana is an endocrinologist, a great friend of the society, dedicated worker, doing many projects out of Surrey Memorial Hospital in how to lower the burden of diabetes. She has a special interest in gestational diabetes and working with the community project with the other doctors how to really get handle on this very, very serious issue of gestational diabetes. So we're really delighted that she has joined us and look forward for this conversation.
thank you very much, Dr. Garg, for this beautiful introduction. And Dr. Reena Khurana, welcome to the program. And it's a great
Thank
honor to
you.
have you today with us.
Thank you,
So,
Harpreet. Yeah.
thank you. We would like to start off with a little bit about diabetes. This is a major, disease which is affecting a lot of people, not only in Canada but all over the world. But especially when we talk about the South Asians, our focus today would be our community. So, you being seeing all this very closely, how serious do you consider this issue?
Oh, diabetes is a very serious issue for everybody, the whole world, including, especially in particular South Asians, as it's quite prevalent in South Asians. Gestational diabetes, which I'm here to talk about more, is definitely an issue here in Surrey and around the world, in particular for South Asians, as South Asians are more at risk for diabetes.
And is there any particular reason, Dr. Khurana, that the South Asians are more prone to diabetes?
Well, I mean, it's probably a multitude of risk factors, right? It's also genetics, right? And environmental, right? So, genetics, we get the genes from our parents and from our forefathers and so forth. And we also, it's environmental, like our diet, our lifestyle. So, back in the old days, people were more active, but we're less active than we used to be. And we're living longer. So, the longer you live, the more chance you're going to have a chronic illness, such as diabetes. And our diet is not as healthy as it used to be, and we're not as active. So there's many reasons why South Asians tend to have more diabetes. That's a big issue. Yeah.
Dr.
Yeah,
Garg, would
RPG,
yes, sir.
this particular issue, we cannot let it go because that has
Absolutely.
been the theme for last 10 years, and Dr. Corona is the leading voice in it. But I think our viewers need to understand that lifestyle plays a huge role.
Right.
Though genetics, more epigenetics, the behavior built on over the years from forefathers plays a big role, but it's a lifestyle. And there is mounting evidence that lifestyle, if doesn't reverse it, can delay it. So for our community, and like today's topic, most gestational diabetes, but I think in general, we want to give this hope to our people that even though the numbers are high, but we could do something about it. We must do something about it. We are doing about it. And then we have doctors like Dr. Khurana and myself as a big champion of this change. And it's up to us to bring that change. Harpreet ji, and that's what that whole integrative thinking is about. Sorry, I just couldn't let that go to
I
re-emphasize
could
that issue.
understand it. I could feel that pressure, which you were feeling to come out and talk, and that's why I asked you to come in. So coming
He
back,
can't help
because
himself.
Dr.
Sorry.
Garg is really passionate about this topic when it comes to
Of course.
lifestyle, and of course, in further discussion, we'll continue with and talk about this issue also. So, Dr. Reena, when we talk about diabetes in pregnancy, can you take us a little bit in depth into this as to how this impacts the lady as well as the child?
So, gestation diabetes, you have to think of gestation diabetes. It only happens in pregnancy. Diabetes, if people don't know, diabetes means that you have a high sugar. But gestation diabetes is only diabetes in pregnancy. It's not, you don't usually have it before pregnancy unless you had gestation diabetes in your last pregnancy. And it should go away when you deliver the baby and the placenta that feeds the baby. So that's what gestation diabetes is. But if you think about gestation diabetes, it's actually a sign to the woman. Men don't have this, don't get this early sign, but it's a sign to the women that they're at risk of getting diabetes in the future. Because we know that gestation diabetes these women have a higher risk of that. And I'll get into that later. Gestation diabetes basically is, what is it? What causes it? Well, when a woman is pregnant, the mom is feeding the baby, basically. The only one who can feed the baby is the mother, of course, right? So all the nutrients, including the sugars, go to the baby. And this is important to know because it stresses the body, and the pancreas has to make more insulin to manage these sugars going higher, okay? So most women can produce lots of insulin and don't get diabetes, but there's some women who have risk factors such as diabetes, they're over 35, their ethnicity, like South Asians, they've had gestation diabetes and so forth. These people have a higher risk of getting gestation diabetes. And so what happens is these women, they produce a lot of insulin, but they're not making enough because there's insulin resistance. And insulin resistance, as we know, is a cause of type 2 diabetes. And when you don't have if you have insulin resistance, your sugars are high. So these sugars, who cares about these high sugars? Well, insulin doesn't go to the baby. And I want to make that very clear. Insulin does not go to the baby. The placenta breaks it down. Okay? So women are scared when we give them insulin, it's going to go to the baby. It does not. Okay. Sugar goes to the baby. The sugar goes to the baby or the fetus. The fetus makes its own insulin because it sees the sugars are high. Insulin is a growth factor. So babies with gestation diabetes, they're bigger. They're bigger babies. They have more fat, especially in the abdomen. They're more risk of jaundice. They're more risk of low sugars when they're born. And very seriously, they could be at risk of respiratory problems because their lungs don't develop. And they could be admitted to the neonatal ICU, which can be very serious. We also know these women, when they have a big baby and they're having a vaginal birth, the baby might get stuck and they might have to have an emergency C-section. So there's all these problems with gestation diabetes. So we know that high sugars cause this. We've proven this time and time again. But we also know that getting these sugars under control in the pregnancy reduces the risk of these complications. Right. And that's why, as an endocrinologist, I work at the Diabetes Pregnancy Clinic. We offer them treatment to help reduce those sugars so we reduce the risk of those complications for both mother and baby.
Okay, that's interesting. It's time for a break. Let's go for a break. We'll be shortly back, and from here onwards, we'll continue and learn more from your wisdom. As an endocrinologist, as you said, what all happens and what needs to be kept in mind by the mother at that time, especially gestational diabetes, what we are focusing on. So we'll learn more from you. And of course, Dr. Garg will be talking about the other aspect when we always talk about that to create awareness in the community, we ought to understand that we need to change our lifestyle. Otherwise, things, the way they are deteriorating, they will continue to do so. So we'll be shortly back and we'll continue with the discussion.
है जुल्म ढाने का अंदाज भी कितना हंसी हमारी जान पर बनाई है जब जब उसने अंगड़ाई ली कभी खामोश रहते हैं कभी शोर होता है मोहब्बत में शरारत का मजा कुछ और होता है दिल को जज्बात का तोहफा खामोशियों को बात का तोहफा, खूबसूरती में जड़ी नजाकत अदाओं की चांद से मुखड़े को चांद सा तोहफा।
भारत ज्वेलर्स, सच्चे प्यार की चमक जैसा। पायल बिजनेस सेंटर सरी।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਈਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604 628 2003।
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਐਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
Once again, welcome back to the program. Our guests today are Dr. Reena, Khurana and Dr. Arun Garg. And as a second Tuesday of every month, we have a collaboration with Canada-India Network Society. And we try to bring in guests from different spheres, especially related with health. And they share their wisdom with you as to how we can live a healthy life. Today, we are focusing on diabetes during pregnancy. And Dr. Khurana is telling us a lot in details, and we will learn more from her also. But before that, some of our sponsors. This program has been brought to you with the support of Day-to-Day Wholesale Cash and Carry. This is British Columbia's largest South Asian grocery store where you can buy groceries, party-wear, kitchenware and homeware at wholesale prices. More than 5,000 products are displayed on the shelves. For best prices, unique grocery buying experience and high-quality products, come to 7843 128th Street, Surrey 604 503 8787. This program is being brought to you with the support of AMC Insurance. If you're looking for home, auto, travel, business, life or recreational insurance, you can depend upon the 9 branches which are serving in the Lower Mainland. And they're open 7 days a week from 8:30 a.m. onwards till 9 p.m. For more information, call 604-507-6666. Let's get back our guests and continue with the discussion. So Dr. Khurana, before the break, as you mentioned that the lady has to be very particular. But what do you find? Why is it that that gestational diabetes, what we are talking about, this has an impact on the baby also? So what would you like to recommend to our viewers, and especially the pregnant mothers?
Well, I like to let them know if they have gestational diabetes, we're here to help them, right?
Mm-hmm.
We have many clinics. We have 4 clinics at Fraser Health. I work at the Jim Pattison Center, which covers Surrey and the surrounding area. And we have one at RCH, Royal Columbian, one at Abbotsford, and one in Burnaby Hospital. So we are there to help them. Even during COVID, we've actually made a lot of adjustments and changes. A lot of it's virtual care, but we are there to help them. We're there to help them, to help them with their diet, with their lifestyle, and treatment if they need. To help them with their gestational diabetes, because we know again that getting their sugars under control helps reduce those risks that I talk about.
Mm-hmm.
And I always think about it like Arun likes to talk about a holistic view, and that's how I like to think about gestational diabetes. And I always say to the mother, it's not about you, it's about the baby, right? Mm-hmm. It's about you as well, but it's also about your family. So the woman has to make a lot of changes quite quickly, right? Like they're pregnant. Pregnancy is only 40 weeks, right? Usually it's diagnosed like in 24 to 20 weeks. So these women are amazing. They do so much. They check their sugars. They change their diet. Like I'm so proud of them. Like how much they do and how much they worry about their baby, right? So they do all these things. And we talk about eating 3 meals a day, having a bedtime snack, watching the carbs, particularly in South Asians, not having them more than 2 rotis, trying to avoid the sweets.
Mm-hmm.
Going back to roti, trying whole wheat flour or chana flour, a flour that's more healthier than white flour, for example.
Mm-hmm.
Those little things that we try to change. Try not to put sugar in the cha, right? Those few things that they can do to help get their sugars under control. We also talk about weight gain, because we talk about how weight gain increases the risk of getting gestational diabetes, but also increases the risk of having, other complications as well. So we take a very holistic point of view, and these women have to make the changes themselves, but they're the ones often or take care of their family. They also have to make changes in their family. And so we hope that by teaching them that they're also teaching their family, right? And it's tough for them. But that's generally what we focus. Mostly we focus on treatment. Sometimes we need insulin. I'll be honest, we do insulin, but it's very safe and everything. But that's the cornerstone of the treatment is diet and lifestyle.
Dr. Garg, here comes your favorite topic, holistic eating. So, could you please talk on this issue? What is it in our community that you are concerned about, and especially pregnant mothers?
Yeah, I think Harpreetji, tonight's message really is that in Surrey and in Fraser Health, and certainly in our area, but globally even, uh, it's critical that we engage people. So tonight's message really is awareness. And the Canada India Network Society, our Canada India Network initiative or meeting 2022 will be on women's health. So in some ways, it's a kickoff of a continuum of awareness and continuum of conversation with our people. And I think that leads to, so it's not like something you just talk today and it will disappear.
Right.
This is really is engagement at its best. And that's what we are doing. So in terms of behavior or lifestyle, obviously nutrition is key, the food. And during pregnancy, the incentive to be healthy is very strong. And as Dr. Khurana said, we are so proud. There is no issue of the culture here that culture in some way gets in the way of being healthy. Mother and child bond is so strong and that care. So I think the issue what we're saying tonight with Dr. Khurana is that gestational diabetes, a type of a subset of diabetes, is important. It has so many effects on health of the baby and the future of the baby. So we want people to be aware of it. Help is there in the form of their physician. Help is there in the form of a specialized clinic. And in it, then, diet becomes quite important. And diet, our diet, Indian diet, gets a bad rap in some ways. Our diet is not bad. If anything, it's very healthy. What happens is that we have kind of lost our way when we eat it, how much we eat it. I mean, and tea, you're drinking tea when you really don't need. So you continue to challenge your body with things you don't need to. So I would say, in terms of diet, keep it simple, no added sugar.
Right.
And that jalebis and rasgullas are the one which have to go. That just other day I was asked to speak to National Institute of Naturopathy, and this conversation came there as well. And in India, it's a huge problem. The
Right.
jalebis and rasgullas and rasmalais, the amount that people eat. In Punjab, I'm told people will go out for outing. And guess what the outing is? Having hot jalebis
Right.
in large amounts. So I think that's what we're really talking about. Common sense. Really, it's not the issue of in any way to say to people, you can't do this, you cannot do that. But common sense and moderation
Right.
and no added sugar. So I think that's will go a long ways. And gestational diabetes is a real strong incentive for us to make people aware of
Right.
diabetes
Very
and
true.
during pregnancy.
Dr. Karana, you have a wide experience of being in this field and seeing. Over the years, what are you observing? Is there a change in the mentality of the people, and especially mothers, when it comes to eating? And are they aware, or still everything continues and then it's all kind of a shock for them?
It depends. Like, I can't say it's every woman is different. Okay.
Right.
Some women, like, they really hold on to it and they keep doing what they're doing after pregnancy. But you have to, postpartum or after the baby's born is a challenge for these women, right? So we taught them how to do a healthy diet. We taught them how to do the lifestyle. They have a baby and they get very busy with the baby, right? And they're not able to do those things that they were supposed to do. they're not supposed to do, but we encourage them to do to reduce their risk of getting diabetes in the future, right? So there's a lot of so I think there's a lot more awareness about healthy diets for sure. There's a lot of, but there's a lot of pressures culturally as well to have that jalebi or have that, it's Diwali, have some sweets, and it's a wedding. I had to go to the wedding, and and there's a lot of pressure on these women, and sometimes I feel bad for them because I understand because I'm part of the culture. I understand where they're coming from, right? So, but I think the women are very smart. A lot of them are smart, and they know this is what this is going to help them, right?
Right.
The challenge is postpartum. Challenge is after delivery, which we're going to be working on that
Right.
issue.
Very true. Again, it's time for a break. Let's go for a break. We'll be shortly back, and then we'll continue in the last segment about after pregnancy, as you said. What all needs to be kept in mind. You have talked about diet, but again, self-care is very important. Dr. Garg is really passionate about kitna khate ho, kab khate ho, kaise khate ho. He always focuses on that the portions need to be kept in mind, and what you are consuming is very important for your health. So we'll talk all about this after this short break. ਵੈਨ ਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 13042 84 ਐਵਨਿਊ ਸਰੀ। ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ, ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ, ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ, ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 604 825 9295 ਉੱਤੇ।
Once again, welcome back to the program. This program is brought to you with the support of Agnihotri Immigration Consulting. If you're wanting to know about temporary status, PR, you're new to Canada, you're an international student, you want to know about citizenship, you want to hire foreign workers, express entry, or sponsor parents or grandparents, then you can take the support of Neera Agnihotri, who has been working as a certified immigration consultant since 2006. She'll provide you honest and reliable information. For more information, call 604-597-2284. 604-597-2284। ਘਰ ਦੀ ਸ਼ਾਨ ਹੁੰਦੀ ਹੈ ਕਿਚਨ ਤੇ ਇਸ ਨੂੰ ਸੋਨਾ ਬਣਾਉਣ ਵਿੱਚ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ ਇੱਕ ਜਾਣੀ ਪਛਾਣੀ ਕੰਪਨੀ ਹਨ। ਕਸਟਮ ਹਾਈ ਐਂਡ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਮਲਟੀ ਯੂਨਿਟ ਪ੍ਰੋਜੈਕਟਸ ਕਰਦੇ ਨੇ। ਹਰ ਤਰ੍ਹਾਂ ਦਾ ਸਪੈਸ਼ਲ ਕੈਬਨਿਟ ਦਾ ਕੰਮ ਕਰਾਉਣ ਲਈ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਨੂੰ ਯਾਦ ਰੱਖੋ। ਕਾਲ ਕਰੋ ਸੁਰਜੀਤ ਤੇ 604-591-8171 ਜਾਂ ਫਿਰ ਇਹਨਾਂ ਦੀ ਵੈਬਸਾਈਟ besthomekitchens.com ਤੇ ਜਾ ਕੇ ਹੋਰ ਜਾਣਕਾਰੀ ਲੈ ਸਕਦੇ ਹੋ। Let's get back our guests, Dr. Reena Khurana and Dr. Arun Garg, and our topic today is diabetes in pregnancy. So as Dr. Garg, I touched upon this issue of how and what to eat. That's what your favorite part is. You always try to create awareness about this. It's been a long time now. You have been going to temples, you have been talking in seminars, you have been meeting people and raising this issue. As I asked Dr. Khurana also that what has she observed during the past, what is your experience? Are people getting aware of this, that the extra sugar is not good for their health, or still it is fine, let's take one jalebi or one gulab jamun? What difference is going to make?
Yeah, in general, Harpreet, it's disappointing. I think our community still is not quite there about lifestyle and especially nutrition and its direct impact. However, having said that, there is a light at the end of the tunnel that in general broader community, there is much more awareness of lifestyle. There are more and more emphasis on nutrition and its role, especially in diabetes. Last month, there was a major conference about reversing diabetes, and we heard from several experts around the world where they have some very good evidence that how they can reverse diabetes through behavior modification. And that is having a positive impact in the community. So
Right.
one of the speaker was from UK and National Health Services, and I asked them question about the very question you're asking: how is the uptake in South Asian community? And he said that out of 200 patients he had where this has been going, a very large number were South Asians, and they were changing their dietary pattern, as Dr. Khurana was saying. So instead of roti is very big part, the wheat, and obviously we don't have time today to fully talk about food because our understanding of the food is getting better and details of how it works. And as when people understand that, then I think they're more prone to. So, like for example, glucose. Why
Excuse me.
high glucose causes all these problems? Where is the trigger of this inflammation? So, I think answer to your question, I'm not enamored. I think I'm disappointed somewhat in the community. Still, there is a huge issue. Part of it is just historical,
Right.
and part of it is that our eating of food is so embedded into so many other things, festivals, ceremonies, and everywhere sugar goes the major part. So I think it
Right.
will take a while, but at least in the professionals and
Right.
it's in the doctors' offices, people are more aware. So it's a start.
Right. So, Dr. Khurana, let's talk a little bit about after the birth of a child. And now, what do you see and what would you recommend to a mother? That gestational diabetes, what we have touched in the previous segment, after the birth, what needs to be kept in mind?
So that's a great question. So we know that women, 16 years from being diagnosed with diabetes, have a 40% risk of getting diabetes, permanent type 2 diabetes. So what we do actually between 6 weeks and 6 months, it depends where you are. Our center does about 6 to 8 weeks after the baby's born. We get these mothers to do a glucose tolerance test. This is the test, the sugar drink that they did when they were pregnant to diagnose them with gestational diabetes. So we ask them to repeat it again, and our clinic will get the results. If they're normal, they just follow up with their family doctor. If they're abnormal, then we talk to them on the phone. We talk to them about their results, and then we talk to them again about diet and lifestyle and weight. We talk a lot about trying to get back to their pre-pregnancy weight, and we talk about ways to decrease their risk of getting diabetes because they've only had one test. You need two tests to confirm the diagnosis of diabetes. So we give them a chance. I say, wait 6 months, try those things that we talked about, and then go follow up with your family doctor to get that checked again, right? So,
Right.
so we do that. I also tell them that if they do have diabetes, that they need to make sure if they get pregnant again to make sure that it's well controlled. Because we know that high sugar, especially early in pregnancy, have even worse complications. So if you have like uncontrolled type 1 or type 2 diabetes in the first trimester, the first part of pregnancy, you're at high risk of miscarriage, and you're also at risk of what we call congenital malformation. So problems with the heart development and the brain development. It's very devastating. Okay.
Right.
I also want to point out that I'm seeing a lot more type 2 women, type 2 diabetes in my clinic. I used to see mostly gestationals. I'm seeing a lot of women that I used to see for gestational diabetes now have type 2 diabetes. It's becoming a big issue. Unfortunately, we're not preventing enough of these women getting type 2 diabetes. So actually, just quickly say is that I'm working with family doctors and endocrinologists. We're working on a program to help these women reduce the risk of getting diabetes postpartum. And Arun is probably going to be helping us with that as well. So that's something that I'm very passionate about because when they leave the clinic, we don't have anything for them really.
Right.
We tell them we suggest what to do, but we don't have any program for them. So we're looking into what we can do for these ladies. Yeah.
Right. So, Dr. Garg, as Dr. Khurana is pointing out that CNS will be coming forward and helping in this segment also. You talked about sugar. Is there anything else also which you would like to recommend, which people, and especially women who are pregnant or after pregnancy, they should be careful of?
Yeah, I think awareness is the key here, RPG, that there is a relationship in the food and chronic disease like diabetes. And once that link is made, then I think behavior changes. And in that link of food or nutrition, simple sugars, so simple sugars like sugars you add, and that's what you have your control on. So I think that's the message is be aware and control it. But I'd like to put further on what Dr. Khurana was saying in terms of her work. There was a paper recently in United States where they compared different ethnic groups and diabetes and pregnancy and gestational diabetes, and most of the minority groups were very high. And it was also said that if awareness was increased, you could reduce it. So there is a positive thing, and I think the work like Dr. Khurana's will be a very big help, and it's a long-term impact on it because a pregnancy diabetic or even gestational diabetic results into long-term complications of diabetes, as Dr. Khurana said, and that's what we want to avoid. So I
Right.
think it's a positive story in the sense that awareness and food plays a major role.
Right. There's so much to learn from what Dr. Khurana, your knowledge and wisdom you have. If I've missed anything, anything technical which you would like to touch upon towards the end, what would be your message to the community with the experience you have had working with women who are pregnant?
Well, I would like to say that diabetes itself is mostly preventable, or at least can be delayed. Okay,
Right.
by incorporating like a holistic, like Arun always talks about, diet and lifestyle, and women trying to watch what you're eating early on in pregnancy as well. We diagnose diabetes in around 24 to 20 weeks. So what can you do before? Well, you can try not to gain weight that's acceptable amount of weight, depending on what your body mass index or BMI was before pregnancy. So we don't want you to gain too much weight in the pregnancy. We want you to eat healthy and be active. And that could potentially also reduce your risk of diabetes or gestational diabetes in that pregnancy. And if you do get gestational diabetes, it's okay. It happens. Despite the best intentions, sometimes it just happens. And we're there to help you. We'll be always there to help you. Yeah.
Right. And if people want more information, especially women, is there any website where they can go to, or
Yeah.
any other resource which they can take advantage of?
Yeah, Fraser Health has we actually I don't have the website in my head, but Fraser Health has
They
some
can Google it.
handouts for
Right.
diabetes and
Okay.
pregnancy. You can Google it. There's actually the handbook that we give the patients as well because we moved to virtual. So everything is downloadable, that what we
Right.
provide these women, and you can just follow what we're doing. Some women already know they're going to get gestational and they already start doing the things that we tell them for the next pregnancy. So yeah, that's a
Right.
great resource is Fraser Health. Yeah.
Okay. And Dr. Garg, anything in conclusion you would like to say?
I think just to reaffirm that we are all in it together.
Right.
All the effort we are making is not that isolating people or any sense of saying that you did it. What we are saying is that there are certain diseases like diabetes. Let's work together, be aware of it, and lower that burden as much as possible. And nutrition and diet plays a role. I am really pleased the collaboration we are developing among doctors. Dr. Khurana and I have become very strong proponent of it. We are working together, and we are hoping that between now and our next meeting in May, which I, as indicated, is women's health. Next time, we're going to bring a doctor from Cancer Agency who is doing a good work in cancer
Right.
and South Asian women. So I think we want to keep this awareness and conversation going, and that's I think will go long ways, because if you look at cardiovascular disease, what has happened, if you look at what's happening in UK in diabetes, the people do listen at the end, and I'm still very hopeful that we could make that difference.
Well, we have to keep bombardment with the right information so that people get aware and they start realizing that we have in ourselves to take the steps, and of course the medical fraternity is there to help them out. Dr. Khurana and Dr. Garg, thank you very much for your time. As always, it's a pleasure talking to you. Thank you for your time.
Thank
Thank
you.
you
I
very
don't
much,
know where
Harpreet.
time goes.
Time
I don't
just
know where the
flies.
time goes.
Time just flies, Dr. Garg.
Yeah, thank
Thank
you.
you.
Thanks again.
But if there is
Bye-bye.
anything you would like to further add on, there's no problem. We have, it's our own program, so we can, if there is anything you would like to add, Dr. Karana or
No, I
Dr.
think,
Garg, yeah.
no.
Okay.
No, that's
Thank
great.
you.
Thank you so
No.
much, Harpreet. Thank you
Thank
for the
you.
opportunity.
Have a
okay?
good evening. Thank you. Bye-bye.
You too. Okay.
ਥੈਂਕਸ ਸੋ ਇਹ ਸਨ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਐਂਡ ਡਾਕਟਰ ਰੀਨਾ ਖੁਰਾਨਾ, ਜਿਹੜੇ ਕਿ ਐਂਡੋਕ੍ਰਿਨੋਲੋਜਿਸਟ ਨੇ, ਤੇ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਜਿਹੜੀਆਂ ਗਰਭਵਤੀ ਮਾਤਾਵਾਂ ਹੈਗੀਆਂ ਨੇ ਉਹਨਾਂ ਨੂੰ ਜਿਹੜੀਆਂ ਇਹਨਾਂ ਨੇ ਐਡਵਾਈਸ ਦਿੱਤੀ ਹੈਗੀ ਉਹ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ. ਫਰੇਜ਼ਰ ਹੈਲਥ ਦੀ ਵੈਬਸਾਈਟ ਤੇ ਜਾ ਕੇ ਤੁਸੀਂ ਇਹ ਸਾਰੀ ਇਨਫੋਰਮੇਸ਼ਨ ਡਾਊਨਲੋਡ ਕਰ ਸਕਦੇ ਹੋ, ਐਂਡ ਦਿਸ ਕੈਨ ਬੀ ਰੀਅਲੀ ਬੈਨੀਫਿਸ਼ੀਅਲ ਸਪੈਸ਼ਲੀ ਫॉर ਐਕਸਪੈਕਟਿੰਗ ਮਦਰਸ ਔਰ ਦੋਜ਼ ਮਦਰਸ ਹੂ ਹੈਵ ਜਸਟ ਡਿਲੀਵਰਡ. And this series of talks which we have every month, this will keep on continuing. If you also have anything you would like us to touch upon, we can get an expert for that. Please do contact us at harpreetsingshow@gmail.com, or you can call me at 604-603-7555 or WhatsApp me. Thank you very much for sparing your valuable time and being a part of this program. And we meet every evening at 6 p.m. Monday to Friday. So if you have anything to share with us, do contact us. Have a safe evening, stay healthy and enjoy yourself.
ਪਾਪਾ ਤੁਸੀਂ ਅੱਜ ਕਿਉਂ ਉਦਾਸ ਹੋ?
बेटा तेरे चाचा दी कोरोना वायरस करके डेथ हो गई है क्योंकि उसने मेरे कहने के बावजूद भी टीका नहीं लगवाया।
ਚਾਚਾ ਜੀ ਤਾਂ ਪੜ੍ਹੇ ਲਿਖੇ, ਸਿਹਤਮੰਦ ਅਤੇ ਰੋਜ਼ ਐਕਸਰਸਾਈਜ਼ ਕਰਨ ਵਾਲੇ ਸਨ, ਫਿਰ ਉਹਨਾਂ ਨੇ ਟੀਕਾ ਕਿਉਂ ਨਹੀਂ ਲਗਵਾਇਆ?
ਉਸ ਨੂੰ ਡਰ ਸੀ ਕਿ ਇਸ ਟੀਕੇ ਦੇ ਮਾੜੇ ਪ੍ਰਭਾਵ ਹੋ ਸਕਦੇ ਹਨ ਅਤੇ ਇਹ ਸੁਰੱਖਿਅਤ ਨਹੀਂ ਹੈ। ਹਾਲਾਂਕਿ ਮੈਂ ਉਹਨੂੰ ਬਹੁਤ ਸਮਝਾਇਆ ਕਿ ਇਹ ਸਭ ਅਫਵਾਹਾਂ ਹਨ ਅਤੇ ਇਹ ਟੀਕੇ ਵਿਗਿਆਨਿਕਾਂ ਅਤੇ ਡਾਕਟਰਾਂ ਦੀ ਮਿਹਨਤ ਅਤੇ ਖੋਜ ਦਾ ਨਤੀਜਾ ਹਨ।
ਪਾਪਾ ਹੁਣ ਤਾਂ ਸਾਡੇ ਸਾਰੇ ਪਰਿਵਾਰ ਦੇ ਮੈਂਬਰਾਂ ਨੂੰ ਟੀਕਾ ਜ਼ਰੂਰ ਲਗਵਾ ਲੈਣਾ ਚਾਹੀਦਾ ਹੈ। ਸਿੱਖ ਹੈਲਥ ਫਾਊਂਡੇਸ਼ਨ ਦੀ ਅਪੀਲ ਹੈ ਕਿ ਅੱਜ ਹੀ ਵੈਕਸੀਨੇਸ਼ਨ ਕਰਵਾਓ ਅਤੇ ਆਪਣੇ ਨਾਲਦਿਆਂ ਨੂੰ ਵੀ ਟੀਕਾ ਲਗਵਾਉਣ ਦੀ ਪ੍ਰੇਰਣਾ ਕਰੋ। ਆਓ ਅਸੀਂ ਸਿੱਖ ਹੈਲਥ ਫਾਊਂਡੇਸ਼ਨ ਦੀ ਇਸ ਮੁਹਿੰਮ ਦਾ ਹਿੱਸਾ ਬਣੀਏ।
ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਨਵੇਂ ਤੇ ਵਧੀਆ ਅਪਲਾਈਐਂਸਸ ਜਿਵੇਂ ਕਿ ਸਟੋਵ, ਓਵਨ, ਫ੍ਰਿਜ, ਵਾਸ਼ਰ ਡਰਾਇਰ, ਮਾਈਕ੍ਰੋਵੇਵ, ਫ੍ਰੀਜ਼ਰਸ ਜਾਂ ਡਿਸ਼ਵਾਸ਼ਰ, ਤਾਂ ਫਿਰ ਪਹੁੰਚੋ ਪ੍ਰੀਮੀਅਮ ਅਪਲਾਈਐਂਸਸ ਤੇ। ਇਹਨਾਂ ਦੀਆਂ 3 ਬ੍ਰਾਂਚਸ ਸਰੀ, ਐਬਟਸਫੋਰਡ ਤੇ ਚਿਲਵੈਕ ਵਿੱਚ ਹਨ। ਇੱਥੇ ਤੁਹਾਨੂੰ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਅਪਲਾਈਐਂਸਸ ਮਿਲਣਗੇ। ਇਹ ਡਿਲੀਵਰੀ ਤੇ ਇੰਸਟਾਲੇਸ਼ਨ ਵੀ ਕਰਦੇ ਹਨ। ਸਪੈਸ਼ਲ ਪੈਕੇजेस ਫॉर ਬਿਲਡਰਸ ਐਂਡ ਹੋਮ ਓਨਰਸ। ਕਾਲ 604-590-4140 604-590-4140।